Ready? Hi, I'm Dr. Skit.
Hi.
Hi, I'm Bob. Nice to meet you.
This is my nurse, Joe.
Hi there, y'all. Nice to meet y'all.
So what brings you to the Get Fixed clinic today?
Well, let me just tell you. Okay, we have 6 kids. Oh my gosh. I'm just worn out all the time. We can't be having any more. Okay, we can't have any more. We've got to end the madness. So we are here to get the problem fixed.
There you go again, this fixing thing. Everything's working fine. There's no problem.
Like I told you before, honey, you've got 2 options, okay? Either fix it or forget it. And I think you know what I'm talking about.
Whatever.
So, you're here for information on the vasectomy.
Yes. Yes, we are. We don't know anything about it, but it sounds like a fantastic idea.
We can give you information and plenty of time to think it over.
I really doubt we're going to need that much time.
And I doubt we'll be making any decisions today, honey.
Okay, well, vasectomies are generally for men over 25 who are serious about not having any more children or if other contraceptives aren't safe. It's also an option if you want to enjoy sex without fear of unwanted pregnancy, men who want to take responsibility for contraception, or men who are concerned about passing on a genetic disease. We advise you not to have one if you are young, or if you divorce or remarry, or if it's soon after the birth of a child. Usually older is wiser. Also, this decision shouldn't be based on financial considerations because those can change throughout the lifetime.
It sounds like he's a perfect candidate. We are definitely done with kids, trust me. He needs to take responsibility for something, and he's definitely over 25. Well, over 25. How effective is it, though?
It is over 99% effective, and it is meant to be permanent.
Now, honey, don't get too eager. We haven't even heard the cost. I'm sure it's more important, more expensive than we can afford.
It can run anywhere from $500 to $1,000, but we'll check with your insurance because it might cover it.
That's great. Thanks, Stephanie.
Sounds fantastic. Where do I need to sign? I'm ready.
Hold on a minute. You're not signing crap. Before we go any further, I've got to know what's going to happen to my boys.
Yeah.
Well, Bob, you come into the office and change into a gown. A local anesthetic will be injected into the area. A small puncture will be made in the scrotum. I will lift the vas deferens out through this opening and snip, snip. It's put back in. A few stitches seal it up, and you're as good as fixed.
Did you hear her? Injection, puncture, snip, snip? I even heard they burn it.
Well, in some instances, we do cauterize the vas deferens.
What I heard was perfect. I am sold. The hotter, the better.
Easy there, scrotum hater. I'm not so sure the boys, these boys belong to me. You can't just say, okay, slip away.
Well, before you decide, you need to know that there are risks and complications that can occur. It is intended to be permanent. The likelihood of successfully restoring it depends on years, since the procedure and it decreases with time.
That's what I'm talking about. Thanks, Joe.
No reversal will be necessary. We are ready. Can we get it done now? Because it'd be really great if I was in time for my time to get home, in time for my show, you know, Dancing with the Stars. Yeah.
What? Are you serious? I don't think so.
Hell yes, I'm serious. Let's get business taken care of. This is what we came to do.
Where's the freaking love? This isn't a task on one of your 100 chore lists. I've grown pretty close to these parts. There has got to be a better way than stripping me of my manhood. What other options are there? Can she be fixed?
Well, actually, there are 2 female sterilization options, tubal ligation and Escher.
Joe, now that's what I'm talking about. See, he understands. I'm all ears.
In tubal ligation, the fallopian tubes are cut or burned to block the union of sperm and egg. It's done through a laparoscopic approach. It's considered permanent. It's not 100% effective, though. 5 women in 1,000 get pregnant after a year, and after 10 years, 18 in 1,000 can get pregnant.
I like the idea of keeping the boys safe. It sounds like a great option. Let's do it. Where do I sign?
Bob, this is an awful idea. No.
Now, honey, let them finish.
Now, it should only be used if you are positive you want to be infertile. It shouldn't be considered if there is any chance you might want kids in the future. If you have any gynecological malignancy or symptomatic gynecological pathology, it is not recommended. The laparoscopic method is not allowed if you have heart or lung disease or are obese.
Do you hear him, Bob? I don't want surgery.
You need to know that there is a risk of infection, uterine perforation, menstrual cycle disturbances, and gynecological problems. If you do get pregnant after the procedure, you are more likely to have an ectopic pregnancy. It doesn't prevent against sexually transmitted infections. And after surgery, it's best if you don't, or if you take a few days off and rest. Sexual activity can begin after 2 weeks. And if the surgery is performed through your vagina, you shouldn't put anything in it for about 2 weeks.
2 weeks?
Yeah, you hear that?
How much does it cost?
Well, it's more expensive than a vasectomy. It can run anywhere between $1,000 and $3,000, but it's usually covered or sometimes it's covered by the insurance.
No way. It's way too expensive and it's way too invasive. I am not having surgery. I've had all 6 of these babies, and what did you do? Not a damn thing. We are done poking and prodding on my body. No way.
Jane, don't you know, if the surgery concerns you, Escher is a surgery-free procedure.
Oh, great. Thanks, Joe. What's the sure? I've never even heard of it. Are you making this up? What is it?
It's a procedure that blocks the fallopian tubes to prevent the sperm and egg tangle. We block it by inserting a small scope into your vagina and cervix. A coiled plug is inserted into each fallopian tube opening. This blocks the tubes and causes scar tissue to form around the coils. It is a 30-minute outpatient procedure, and you can return to work after 3 to 4 hours.
Well, this sounds perfect. This is the solution. No surgery for you, and the boys stay safe and sound.
No one is inserting anything into my vagina. Did you hear him? Bob, we are not getting me fixed. It is your turn, mister. Plus, we don't even know if I'm a candidate for this.
It's mostly intended for women who have internal abdominal scarring that prevents a tubal ligation. The benefits include quick recovery, no visible incision or scarring, a lack of significant long-term side effects, and convenience.
However, it's not recommended if you might want more children, recently gave birth or had an abortion, recently had a pelvic infection, are sensitive to nickel, or allergic to the contrast agent used to confirm tubal blockage, had tubal openings that are not accessible, or previously had a tubal ligation.
This sounds too good to be true. Now to the most important question. How effective is it?
It's a little over 99% effective. It is estimated that 1 out of every 100 women get pregnant the first year. If this happens, there's a higher incidence of ectopic pregnancy.
Bob, this is too risky. With our luck, we'd be pregnant in a month.
Now, just hold on a second. Dr. Ski, is there anything else we should know?
Yes, there are risks involved. They include blockage occurring on only one side, perforation of the uterus or fallopian tubes, pelvic pain, or infection. It doesn't prevent against STIs. You have to use a backup method of birth control for 3 months or until we can confirm the blockage on an X-ray. Side effects can include cramping, abdominal pain, nausea, vomiting, dizziness or lightheadedness, and bleeding or spotting. You might be asked to use a hormonal contraceptive that contains progestin before the procedure to thin the inner lining of your uterus, so the tubal openings are easier to assess.
Please tell me this is cheaper than a tubal ligation.
It's around the same price. It runs from $1,000 to $2,000, but like the others, most insurance will cover it.
Well, that settles it then. The vasectomy is by far the cheapest. It's the only way to go.
Well, you're not listening to them? I'm not so sure. Tim had it done, and he said he was bruised and swollen.
Well, sweetie, that's a sacrifice I'm willing to make. Okay? If you want to get that new set of golf clubs that you've been talking about so much, the vasectomy is the only way.
Damn, are you?
We've given you a lot of information. You should go home and think it over. You don't want to be too hasty.
That's true, but when a woman knows, she knows.
Exactly.
I think we have some talking to do.
Well, talking is all that will be happening until the deed is done.